meta-analysis of 12 clinical trials with over 550 adults found that garlic reduced systolic blood pressure by 8 to 10 millimeters of mercury. To put that in perspective, that's nearly the same reduction as standard blood pressure medication. And yet most doctors will never mention this to you. I'm going to show you exactly how to use garlic to lower your blood pressure naturally, the right form, the right dose, and 3 simple recipes you can start today. High blood pressure is called the silent killer. It affects nearly half of all adults, and most people don't even know they have it. It quietly damages your arteries, your heart, your kidneys, even your brain. And while medication works, many people experience side effects: dizziness, fatigue, frequent urination, dry cough, muscle cramps. The list goes on. But what if nature already gave us a powerful tool to fight back? That's exactly what the science says about garlic. I'm your host from MediMint Health, where we break down the science behind natural remedies so you can make informed decisions about your health. Stick with me through this entire video because the warning section near the end could literally save your life. Let me quickly explain what's actually happening inside your body when you have high blood pressure. Your blood vessels are like flexible tubes. When your heart pumps, blood pushes against the walls of these tubes. That pressure is your blood pressure. A healthy reading is around 120/80. When that number stays elevated, say 140/90 or higher, you have hypertension. Over time, that extra force damages your artery walls. It makes your heart work harder. It increases your risk of heart attack, stroke, and kidney disease. The scary part? You can feel completely fine while this damage is happening every single day. No symptoms, no warning signs, just slow, silent destruction happening inside your body around the clock. So where does garlic come in? Let me show you the fascinating science behind this humble kitchen ingredient. When you crush or chop raw garlic, an enzyme called alliinase converts a compound called allicin into allicin. Allicin is the star of the show. It's what gives garlic that sharp, pungent smell and most of its medicinal power. Here's where it gets really interesting. Once allicin enters your body, it breaks down into several sulfur compounds. One of the most important is hydrogen sulfide. Yes, the same gas that smells like rotten eggs. But in small amounts, hydrogen sulfide is actually a powerful signaling molecule. It tells the smooth muscle cells in your blood vessel walls to relax. When those muscles relax, your blood vessels widen. Doctors call this vasodilation. Wider blood vessels mean less resistance, and less resistance means lower blood pressure. Think of it like a garden hose. Squeeze the hose tighter and pressure builds up. Release your grip and pressure drops. Garlic is essentially telling your blood vessels to loosen their grip. But that's not all. Garlic also increases the production of nitric oxide, another powerful vasodilator, and it has anti-inflammatory and antioxidant effects that protect your artery walls from ongoing damage. So garlic works through multiple pathways simultaneously. It's not a one-trick compound. It's attacking high blood pressure from several angles at once. And the clinical evidence for this is surprisingly strong. Let me show you the 3 most important studies. Study number 1, a 2008 meta-analysis published in BMC Cardiovascular Disorders, reviewed 11 randomized controlled trials. They found garlic reduced systolic blood pressure by an average of 4.6 millimeters of mercury compared to placebo percent. Not huge, but statistically significant. And remember, this included people with normal blood pressure too. Study number 2, and this is the big one, a 2012 meta-analysis by Reed and colleagues, published in the European Journal of Clinical Nutrition, analyzed 12 trials involving 553 adults with hypertension. They found garlic supplementation reduced systolic blood pressure by 8.4 millimeters of mercury and diastolic by 7.3 millimeters of mercury in people who already had high blood pressure. That's comparable to ACE inhibitors and beta blockers. Let that sink in for a moment. A food you can buy at any grocery store producing results comparable to prescription medication. Study number 3. A 2019 trial found that aged garlic extract at 1,200 milligrams per day for 12 weeks reduced central blood pressure, arterial stiffness, and even improved gut microbiota. So the evidence isn't just promising, it's robust. Multiple studies, multiple research teams, consistent results. But here's the thing most videos won't tell you. The form of garlic you use makes a massive difference, and most people get this completely wrong. Let's break it down, form by form. Raw garlic is the most potent natural form. When you crush it, allicin is produced within seconds. But, and this is crucial, allicin is very unstable. It starts degrading almost immediately, and heat destroys it. So if you're cooking garlic in a stir-fry and thinking you're lowering your blood pressure, you're mostly getting flavor, not medicine. Here's a pro tip though. If you do cook with garlic, crush it first and let it sit for 10 minutes before cooking. This allows the allicin to form and partially stabilize, so some of it survives the heat. Cooked garlic still has some benefits. Sulfur compounds and antioxidants remain, but the blood pressure lowering effect is significantly weaker. Garlic supplements vary wildly. Many cheap supplements contain almost no allicin by the time they reach your gut. Look for supplements that are enteric-coated and standardized to contain at least 1.8% allicin. Or look for ones that list allicin yield on the label. If the label doesn't mention allicin content, move on. Aged garlic extract, often abbreviated AGE, is actually the most studied form in clinical trials. It doesn't contain allicin. Instead, the aging process creates unique compounds like S-allicystine that are stable, bioavailable, and clinically proven to lower blood pressure. The brand most used in research is Keolic. My recommendation? If you want the most evidence-backed option, go with aged garlic extract at 600 to 1200 milligrams per day. If you prefer natural whole food, use raw crushed garlic, 2 to 4 cloves daily. Now, let's talk exact dosage and timing. For raw garlic, 2 to 4 medium cloves per day. Crush them and let them sit for 10 full minutes before consuming. For aged garlic extract, 600 to 1200 milligrams per day, split into 2 doses, morning and evening. For garlic powder supplements, 600 to 900 milligrams per day, standardized to 1.8% allicin. When should you take it? Take garlic with meals to reduce stomach irritation. If using raw garlic, the best time is in the morning on a lightly filled stomach. And here's something important. Garlic is not a quick fix. The studies show blood pressure reductions appear after 8 to 12 weeks of consistent daily use. Consistency is everything. You can't eat garlic for 3 days and expect miracles. Now let me give you 3 easy recipes to actually make this enjoyable. Because let's be honest, chewing raw garlic is not exactly a pleasant experience. Recipe number 1, garlic tea for blood pressure. Take 2 cloves of garlic. Crush them and let them sit for 10 minutes. Boil 1 cup of water, then let it cool for about 2 minutes. You don't want boiling water destroying the active compounds. Add the crushed garlic, a squeeze of fresh lemon juice, and a teaspoon of raw honey. Stir it well and sip slowly. Drink this once daily, preferably in the morning. The lemon adds vitamin C, which actually helps protect the allicin compounds. The honey soothes your throat and adds its own cardiovascular benefits. Recipe number 2, the garlic honey jar. This is a popular folk remedy that's actually backed by science. Take a small mason jar, fill it with peeled garlic cloves, about 10 to 12. Cover them completely with raw honey. Seal the jar and let it sit at room temperature for 3 to 5 days. Flip it occasionally so every clove gets coated. The honey draws out the garlic compounds while the garlic infuses the honey. Eat 1 to 2 cloves daily, straight from the jar. The honey masks the harshness beautifully. Recipe number 3, garlic lemon ginger water. Crush 2 garlic cloves and let them sit for 10 minutes. Add them to a glass of warm, not hot, water with the juice of half a lemon and a small piece of freshly grated ginger. Stir well and drink. This is a powerhouse combination because garlic isn't the only food that helps lower blood pressure. Garlic works even better when combined with other blood pressure-friendly foods. Here are the top 3 combinations. Number 1, garlic plus ginger. A 2019 meta-analysis found ginger reduces systolic blood pressure by about 6 millimeters of mercury. Combined with garlic, you're targeting multiple pathways: vasodilation, anti-inflammation, improved circulation. That's why recipe 3 is so powerful. Number 2, garlic plus hibiscus tea. Hibiscus is one of the most well-studied herbal remedies for blood pressure. Research shows it can reduce systolic blood pressure by 7.6 millimeters of mercury. Try adding crushed garlic to cooled hibiscus tea with a squeeze of lemon. It sounds unusual, but it works. Number 3, garlic plus potassium-rich foods like bananas, sweet potatoes, and spinach. Potassium helps your kidneys flush out excess sodium, which is a major driver of high blood pressure. A meal with roasted sweet potatoes, spinach, and a raw garlic dressing covers multiple bases at once. Also consider reducing sodium intake, increasing magnesium, and regular walking. These all compound the effect dramatically. Now, this next part is really important. Please don't skip this. Garlic is generally safe, but there are situations where it can cause serious problems. Warning number 1, blood thinners. Garlic has natural anticoagulant properties. If you're taking warfarin, aspirin, or any blood-thinning medication, high-dose garlic can increase your risk of bleeding. Talk to your doctor before starting garlic supplementation. Warning number 2, surgery. Stop garlic supplements at least 2 weeks before any scheduled surgery. Same reason, bleeding risk. Warning number 3, low blood pressure. If your blood pressure is already low or you're on blood pressure medication, adding garlic could drop it too far. That means dizziness or fainting. Monitor carefully. Warning number 4, stomach sensitivity. Raw garlic can cause heartburn, nausea, or stomach upset. If this happens, switch to aged garlic extract. It's much gentler on the stomach. Warning number 5, garlic is not a replacement for prescribed medication. If your doctor has put you on blood pressure medication, do not stop it and switch to garlic on your own, ever. Garlic should be seen as a complementary approach, something that works alongside your treatment plan, not instead of it. Always involve your healthcare provider in these decisions. All right, here's what I want you to do. I'm calling this the 30-day blood pressure challenge. Step 1, choose your garlic method. Raw cloves, aged garlic extract, or one of the 3 recipes I shared. Step 2, use it consistently every single day for 30 days, no days off. Step 3, measure your blood pressure at the same time every day, ideally in the morning before eating. Write it down or use a tracking app. Step 4, after 30 days, compare your numbers. Based on the science, if you're consistent, you should start seeing meaningful changes within that time frame. Let me recap the key takeaways. Garlic lowers blood pressure through allicin, hydrogen sulfide, and nitric oxide pathways. The best forms are raw, crushed garlic, 2 to 4 cloves daily, or aged garlic extract at 600 to 1200 milligrams daily. Give it 8 to 12 weeks. Combine it with ginger, hibiscus, and potassium-rich foods for even better results. And always check with your doctor if you're on medication. If you found this helpful, please hit that like button. It really helps this video reach more people who need this information. Subscribe and turn on the bell so you never miss our weekly deep dives into natural health solutions. Drop a comment below telling me, are you going to try the 30-day challenge? Which recipe are you most excited about? I read every single comment. And if you want to go even deeper, watch this video next where I break down the top 10 foods scientifically proven to lower blood pressure. Number 7 will surprise you. I'll see you there. This content is for educational purposes only. Please consult your doctor before making health changes.